Today in this lecture we will talk about the role of atrial natriuretic peptide or ANP in the reabsorption of sodium, water, formation of urine, and its role in fluid balance. So atrial natriuretic peptide, as the name indicates, it is secreted from the atria, and especially the right atria. Some specific cells in the right atrium will secrete atrial natriuretic peptide ANP whenever the atria is stretched more than normal. So normally the ANP will not be secreted, but when there is fluid overload in the body and a lot of fluid returns to the right atrium of the heart and it gets stretched more, it will lead to the release of ANP. When it is released, this ANP, atrial natriuretic peptide, will come and it will act on the nephron tubules, and it will especially act on the collecting ducts. And in the collecting ducts, it will decrease the reabsorption of sodium. It will inhibit the reabsorption of sodium, and due to inhibition of the reabsorption of sodium, there will be no reabsorption. There will be less reabsorption of water as well, which will lead to a lot of sodium and water excretion in the urine from the renal tubule through the urine outside the body. So this peptide, the ANP, it acts to decrease the reabsorption of sodium, which in turn decrease the reabsorption of water, which in turn decrease the fluid overload in the body, and which in turn decreases the fluid overload on the heart. So its role is in maintaining the fluid overload, decreasing the fluid volume in the body, and as well as it also has a role in modification of the urine. That's why it is also being discussed here, as we have discussed the role of aldosterone, we have discussed the role of angiotensin 2, and we have discussed the role of the antidiuretic hormone. All of them modify the formation of urine. All of them modify the concentration of urine. All of them are secreted in different volume status. It depends whether the arterial pressure is high or low. It depends on whether there is volume overload or less volume of the blood in the body. So these triggers lead to the release of aldosterone, release of angiotensin 2, release of antidiuretic hormone, as well as the release of atrial natriuretic peptide, and all of them modify the urine. So atrial natriuretic peptide also modifies a urine, and that's why it is being discussed in the topic of reabsorption and urine formation. And that's the role of the atrial natriuretic peptide. It gets secreted when fluid overload stretches the right atria, and it decreases the reabsorption of sodium and water. That's all about ANP. Thanks a lot for watching the video.